let's move on in that direction. So I think we all agree that nonsteroidals are effective analgesics, and that they will help prevent musculoskeletal system deterioration, the somatosensory system deterioration, the sensitization, the wind-up, prevent a decline in cognitive function, to prevent those deleterious other affective sequelae. But maybe thinking and still trying to think about effective analgesics outside of COX inhibition. What, Sheilah, what do we have outside of direct classical cyclooxygenase inhibition? What options do we have?
So we're focusing on drugs, and it's been mentioned briefly. We've got the PIP prints. So what we're trying to do is go for targeted therapy. So in the past, we've blocked pathways that lead to what we don't want. So, if you think about it way back, corticosteroids, then we got a little bit lower down the pathway, and then we got sort of individualized COX-1 and COX-2, and now I think what we're trying to do is get lower down the pathway. So, for example, the PIP prints.
Which is this drug that we're talking about?
So the drug would be grapaprint,
right.
Which is approved for dogs. So we already have that drug. So it's working as a receptor blocker. So we're looking at blocking receptors rather than inhibiting a pathway, which might have actual beneficial effects in some ways. So I think going for the targeted, therapies is definitely important in these animals, especially the ones with comorbidities, where we're less likely to have complications if we go for targeted treatment. So I think the PIP prints, and then especially grapaprint, which we now have for dogs, and hopefully we might see it for cats, I think is big. So that would be the one thing. There's been very little attention paid to the LOX pathway for a long time, the lipoxygenase pathway, which we know is involved, but it's not been talked about for a long time. And we've only ever had one dual inhibitor on the market, and it's no longer available.
So that's a great non-COX inhibiting option, grapaprant, the first of the PIP rank class. And then Margaret, we talked earlier about nerve growth factor and preventing its action. How is that going to be an effective analgesic in the same degree as the nonsteroidals, or maybe greater?
It appears to be. I mean, what we saw in cats is that the improvement on an activity monitor basis is the same or more than a nonsteroidal. So, and the benefit, particularly for cats, but even for dogs, is that it's a injection that's given over spaced intervals. So for cats that are difficult to give a medication to every day, it's a potentially very attractive owner option, and for the cats. So I think that that monoclonal group is going to be really interesting and effective.
So not quite with us yet.
Not quite with us yet.
On that,
very close.
Very close. On that note, Mark, what other potential therapies, non-COX inhibiting therapies, are on the horizon, sticking around this theme of a really effective, predictable pain relief?
There are other pathways off that arachidonic acid pathway that are under investigation right now. So the soluble epoxyhydrase inhibitors, and I won't go into the neuropharmacology of that, but it can potentially give anti-inflammatory analgesic effects with possibly a little better adverse effect profile.
So these SEHIs are drugs that increase the production of anti-inflammatory.
Correct. So the end of that pathway are pro-inflammatory molecules, and if you inhibit that, they kind of shunt over to these anti-inflammatory molecules. So that is the crux of it. And like I said, they're just investigational right now. But there's promise down there. We have, of course, the whole realm of the SNRIs that we use a lot. So we use these products, gabapentin, we use a lot. We just don't have a lot of data about them. Amantadine is your study, so we use them, but we just don't have a lot of data about them. And I think that those are areas that deal with maybe treating or preventing some of the damage to the spinal cord, the sensitization component. Okay. So those will be critical. One area that we really haven't talked too much about here are other biologics. These are intra-articular injections, and these may be as infrequent as every 6 months or a year. Who knows? We don't. So this is where we have the promise of stem cells. It's moving from the autologous mesenchymal. The research is now over to the allogeneic, kind of universal donor type. And then PRP, or platelet-rich plasma, plus or minus hyaluronic acid. So we're in the wild west of those, I have to say. We do utilize them in our practice, but and there's evidence that is encouraging. It's all pointing to a clinical benefit, but we really don't know highest, best, wisest, and safest use of those products. And they are minimally invasive, right? You do have to be able to get into a joint. The hip is not as easy as others, as Brian will say. And yet they show, in my view, pretty nice promise.
So it sounds like we have the nonsteroidals, they're predictably efficacious analgesics. We have the PIP-brants, the same there. Right on the horizon, the anti-nerve growth factor therapies that look extremely promising in terms of pain relief, and a number of other possibilities coming down the line.